The number of Ebola cases in Liberia and Sierra Leone could rise to between 550,000 and 1.4 million by January if there are no additional interventions or changes in community behavior, the Centers for Disease Control and Prevention said in a report Tuesday. The estimate was derived from a new forecasting tool developed by the CDC. The range of estimated cases to come, from 550,000 to 1.4 million, is why because officials say they think the current case count is highly underreported. The official death toll from Ebola in West Africa has climbed to more than 2,800 in 6 months, with 5,800 cases confirmed as of Monday, the World Health Organization said, but the CDC estimates that if 70% of people with Ebola are properly cared for in medical facilities, the epidemic could begin to decrease and eventually end. Given that several countries and organizations have pledged to provide more support for the Ebola-affected countries, the CDC report suggests the higher projections of cases in the coming months might be avoided. Perhaps most important, Ebola has reached the point where it could establish itself as an endemic infection because of a highly inadequate and late global response. It warns that the global response must improve to meet the threat posed by this and future epidemics. Another 6-month report from WHO, which assesses the situation in 3 countries at the Outbreaks Center, Guinea, Liberia and Sierra Leone, is dedicated to those health workers who, as an expression of our innately shared human compassion, risked their lives, and lost them. In the 6 months since this outbreak was first formally reported in March, 337 healthcare workers have been infected, of whom more than 181 have died, WHO said. The situation assessment for Sierra Leone explains how traditional burial practices helped the virus spread quickly there following the funeral of a respected local healer. The virus has taken a devastating toll on health workers and researchers who sought to contain its march. Sierra Leone's most urgent needs include more treatment beds in much safer facilities, better contact training and follow-up, more personal protective equipment and body bags, and more properly protected teams to collect bodies and bury them safely, WHO said. The deployment of international medical teams in West Africa, including from China and Cuba, may go some way to help. Nigeria and Senegal, where the situation is judged stable, for the moment, are seen as success stories so far. They have shown that conventional methods such as early detection, tracing of those who've been in contact with infected patients, isolation and adequate supply of personal protective equipment can contain the virus, WHO said. If Nigeria can control an outbreak caused by such a deadly and highly contagious virus, right from the start, any country in the world can do the same, its report said.